Good afternoon, everyone. We'll be starting in just a few minutes. We're going to give people a couple of minutes to join. Okay, good afternoon, everyone. Welcome to Industry Showcase. Today is October the 25th. My name is Shannon Bott, and I will be hosting with you today. The region of Durham, where I am today, exists on lands that the Mishi-Sagig-Ashinabweg inhabited for thousands of years prior to European colonization. These lands are the traditional and treaty territories of the nations covered under the Williams Treaties, including the Mississaugas of Scugog Island First Nation, Alderville First Nation, Hiawatha First Nation, Curve Lake First Nation, and the Chippewa nations of Georgina Island, Beausoleil, and Rama. We honor, recognize, and respect Indigenous peoples as rights holders and stewards of the lands and waters on which we have the privilege to live. In our effort towards reconciliation, we continue to build and strengthen relationships with First Nations, as well as the large Métis communities and growing Inuit communities here in Durham. We commit to learning from Indigenous values and knowledge, building opportunities for collaboration, and recognizing that we are all connected. Please share in the chat territory you are joining from. Today's Industry Showcase is brought to you by Seamless MD, reducing length of stay, ED visits, and readmissions, enabling safer transitions from hospital to home with digital care journeys. It's my pleasure to introduce Dr. Joshua Liu. Dr. Liu is physician turned entrepreneur. He is currently the CEO and co-founder of Seamless MD, which provides the leading digital care journey platform for health systems to engage, monitor, and stay connected with patients across healthcare journeys. Dr. Liu, welcome.
Thank you, Shannon, and thank you, Digital Health Canada, for organizing this amazing session today. And thank you, everyone who is joining us for this session. As Shannon noted, we are recording the session, and we'll be sharing with you all afterwards as well. We also will be hosting a Q&A at the end, but we will be checking the questions throughout. So if you do have one, please drop it throughout the conversation, and we'll try to get through things today. I am really, really excited to be joined by two incredible healthcare leaders who will be sharing their wisdom, their learnings, and strategies for success. First, I want to introduce Carolyn Fanti. Carolyn is the Director of Regional Surgical Services at Thunder Bay Regional Health Sciences Center. Carolyn is passionate about building and implementing innovative models of care for Northwestern Ontario and their patients. She's led initiatives for all kinds of things, centralized intake, rapid access clinics, bundled care, remote patient monitoring, and often is leveraging new technologies and interprofessional care teams to deliver better outcomes. For her leadership in healthcare transformation, Carolyn was recognized as the RBC Innovation Hero of the Year in 2021. I'm also excited to introduce Adriana Lukic, the Director of Digital Solutions at St. Joseph's Healthcare Hamilton. Adriana has spent over the past decade leading a variety of change initiatives and innovative healthcare transformation projects. She holds a honors BSc in kinesiology and an MBA from McMaster University, a PMP certification, and is ProSci Change Management certified. So thank you, Carolyn and Adriana. And as Shannon mentioned, I myself am the co-founder and CEO of Seamless MD. I'll be moderating today's session. I came from the clinical world over a decade ago, became passionate about quality and safety, and then became excited about using technology to improve the patient journey. And you heard a little bit about us earlier, but just to give you a bit more context, we provide a digital care journey platform at Seamless MD used by hospitals and health systems to engage, monitor, and stay connected with patients across different healthcare journeys, whether that's pre and post-surgery, maternity care, behavioral health, and so on. We've been validated by over 40 studies and evaluations to improve outcomes and metrics such as length of stay, readmissions, ED visits, and costs. And in 2022, we were honored as the Ken Health Network's Company of the Year. And I'm just really excited to say, this is fresh off the press. We were just named by Class Research as the #1 solution for improving outcomes in 2023. So super exciting year. Before we get to our discussion today, we did want to do a quick poll just to get a pulse check for, what are the main priorities you all are facing in your organizations over the next 6 to 12 months. So I'm just going to launch this poll and wait for the results to come in. And really, we want to get your feedback because this will help inform parts of our discussion today. And I'm going to give it a couple of seconds folks to come in. Actually, it's funny. It's like watching a horse race a little bit because I'm seeing different answers, go up and down. And by the way, I know that for many of you, it might feel like all of these are priorities, but I guess we're forcing you to pick one. All right. I'm going to end the poll in a couple of seconds. All right. I think we got a good sample here. All right. You should be able to see the results now. I'll read it out to you if you're not looking at the screen. In first place, reducing readmissions and ED visits at 26%. Oh, I'm sorry. All of the above, actually. I was wrong. You can't pick all of the above. All of the above in first place at 38%. Reducing readmissions ED visits in second place at 26%. Lowering length of stay in third at 19%. In the backlog at 14%. Curious, maybe Caroline, we'll start with you. You surprised by what you're seeing here?
Not at all. Before I realized that there was an all of the above, I thought, wow, this is really the return on investment and key performance indicators that we monitor, and they're tied together. If you want to reduce surgical backlog and wait times, you need to shorten hospital length of stay. And while you're doing that, you cannot increase your readmissions and your ED visits. So it really all goes hand in hand.
That's a great point. And Gianna, does this mesh with what you're seeing in Hamilton or what you're hearing from your peers?
Yeah, it definitely resonates, Josh. And I think what's interesting is we had these discussions coming out of COVID and really understanding how we would ensure that we could treat all those patients who needed the support. And so the conversation we had at St. Joe's is how can we use technology to support these key drivers and get patients through the hospital quicker, at home, comfortable, resting and recovering appropriately. So it makes total sense to me.
Absolutely. And I think one thing that's probably not surprising to folks is reducing phone calls, although that certainly can take time away from maybe more pressing matters. Clearly, there's so many pressing matters that everything else is coming first beyond phone calls. So it makes a lot of sense. Wonderful. Thank you everyone for participating. That gives us a lot of good insight into the discussion today, and I think you'll find everything really relevant. So before I get to really the stars of our show, Adriana and Caroline, I did want to spend a couple of minutes just setting the stage for the conversation. And maybe I'll start with kind of what's big in the headlines right now, because it all kind of resonates together. So we all know that over the last couple of years, the pandemic has created a massive backlog in care, specifically in surgery. And it's gotten so bad that there are some provinces and regions that are not even having to outsource surgery to our neighbors in the US. Meanwhile, as you all know, we're facing an ER crisis of epic proportions. It's gotten so bad that actually a couple of days ago, some headlines came out where in 2023, more than 1.3 million Canadians who've gone to the ED actually had to abandon it and go back home or go to a different place for care. And apparently that is 34% higher than in 2022. So that problem has just gotten worse. And so, I know I'm preaching to the choir, but I'll underscore that our healthcare system is under pressure to discharge patients sooner, do more throughput, do more surgery, and yet somehow we have to find innovative ways to also keep patients healthy at home and out of the hospital and the ED. And so, as I'm sure, one of the things we think about is, well, how can we, innovate and re-engineer the patient journey to help solve some of these challenges? And just to kind of level set the patient journey a little bit, whether we're talking about a surgery or a cancer journey or something else, I think we all realize as a patient, we often get lots of paper and verbal instructions, which folks tell us they lose, they forget, there's no day-to-day reinforcement, and so it can be hard to follow. And providers often feel as if we're sending patients into a black hole, especially after discharge with limited support in the community until the next follow-up visit. And if patients can't stay on track with their care plans and providers can't easily keep an eye on you, bad things can happen. And ultimately that can drive cost to the system. We have done some good work, I think, in healthcare over the last decade in using technology to do that. One of the things that has been pretty helpful has been, what I call remote monitoring 1.0, the idea that we can ship, a device and sensors to a patient's home, and we can monitor patients with a lot of high touch, high intensity support. This has worked really well for some complex chronic diseases like heart failure and COPD. But I think one of the challenges we've seen over the years is that it's hard to scale that across, thousands of patients across multiple clinical areas across the system in terms of the cost and the intensity of doing that level of support. Meanwhile, I think a lot of folks here who are in the innovation technology space have realized that we've seen the rise of more digital savvy healthcare consumers and patients. We now see that almost 60% of patients, want access to digital to be part of how they manage their care, and that number keeps rising. And so, how do we scalably reach other patients, like the 70-year-old heart surgery patient who'd rather send in an incision photo than drive 3 hours for a wound check? Or what about that 65-year-old patient who just had their knee replaced, who wants to do virtual rehab and physiotherapy? Or even what about our 30-year-old soon-to-be mom who, wants to get her pregnancy education on her smartphone, but wants it to be, vetted by her clinical team, and who also wants to be monitored postpartum during recovery? How do we support all of those patients? And so that begs the question of, well, what does it look like to digitally reach, near 100% of patients in a much more scalable way? And that's really where our discussion on remote patient monitoring 2.0, or what we call digital care journeys, comes in. So, the way to think about it is, in the same way that a GPS can guide any one of us to travel from point A to point B, digital care journeys like Seamless MD are in many ways a way to turn a patient's smartphone, tablet, or desktop computer into their very own GPS to guide them through a complex care journey, whether that's pre and post surgery or a cancer journey or a mental health journey. And the idea is to send really specific clinical reminders throughout that journey, get pre and post care education, help them monitor their symptoms, and essentially give them a safer transition from hospital to home, while also, where relevant, integrating with EHRs like Epic, Cerner, and Meditech. And just to give a little bit more context for what we're talking about, here's how it could look for a patient going through a total knee replacement. So, you start with these out-of-the-box evidence-based care plans that clinical teams will customize to match how you do things. And let's say 7 days before your knee replacement, you're getting reminded, stop your blood thinners on time. You get daily to-dos on getting the right safety equipment for your home. After your surgery, you're prompted with evidence-based education on here's how to do your rehab and physio. When you go home, you get prompted every day to track your pain levels, take a photo of your incision, track your range of motion. And, for the 80% of the time where it's not a red or yellow flag and you just need the right education on how to manage, like how to manage your constipation at home, you get prompted on how to do that. And we can minimize calls and visits at the hospital. And the idea is that, how do we scale this to many other use cases? So for maternity care, it means educating patients throughout and monitoring them postpartum. For something like bariatric surgery, it's about getting that nitty-gritty engagement on here's how your diet changes during your recovery. And then layer on top of that, all that data we're tracking from patients, being able to alert providers for red or yellow flags that matter most, giving them dashboards to remotely monitor this data. And, I think we found two key insights really matter from this monitoring. One is that when patients and providers know they're going to stay connected through this platform, they're more confident for early discharge. And two is you can actually catch a lot of things much earlier. Carolyn, I think you had a comment you want to jump in on.
Yeah, I just wanted to share that in our first 3,000 patients that we provided care to, 85% of patients only required the self-management that they received directly from the app. 14% needed a call from our nurse practitioner team, and 1% or 30 out of 3,000 were instructed that they needed to go to the emergency department based on their based on how they answered their health survey, showing us some red flags. So I thought that was helpful context.
Yeah, that's amazing. I think that speaks to the power of engaging and empowering patients. I think to your point, I think we hear from patients that they don't want to call in if they don't have to, but if they have to be given the opportunity to learn how to self-manage. Andriana, I'll go to you.
I was just going to say, it's interesting to hear that from Carolyn, and it's consistent with our experience. So 1% of our patients did actually require escalation through the program based on the thresholds we set within the actual technology. And so really patients were able, with the tools that they had in their hands through the Seamless MD application, able to self-manage, self-monitor. And really, I think what's important is when they did need that support, there was a pathway there that they were able to take, and a care team member on the other side that was ready to guide them for their next most appropriate steps.
Cool. And it sounds like maybe, Andrew, to jump off of that, a key thing is like your team actually decides like what are those thresholds for escalation. So it's not here's what it is, you have to use it. It has to actually match your clinical workflow.
Yeah, absolutely. So our clinical pathways could be respected as we configure the technology.
Awesome. Well, excellent segue, actually. So maybe what we'll do is, I think the next thing really was to, before we get into the actual expertise of Andriana and Carolyn, we had one last poll, and that's just to give us a bit more context for where everyone is on their digital and remote monitoring journey. So I'm going to launch this poll real quickly. All right. And curious to know where everyone is on their journey. In the meantime, I'm going to multitask, and we have a question. So the question is, I assume the remote monitoring data goes back to, I guess, the hospital care team, or do you use any of this with the primary care team? Maybe Carolyn, we'll start with you. is it mostly the hospital team, or are you involving primary care in the monitoring?
It is our hospital team, but we are a network. We are centrally located in Thunder Bay, but we support a geography the size of France for 220,000 patients. And we are a 4-site program. And for context, our other hospital partner sites are 3.5 to 6 hours away. So the patients we're caring for, they really need a safety net under them because they are far away from their surgical care team.
Makes a ton of sense. And Andrea, you're in more of a, I guess, a centralized or urban area in Hamilton. Does that change for you? Or are you involving primary care as much as you're involving the hospital team at this point?
At this time, we're working with the hospital team as that first point of contact. And what may happen is upon review with that patient, if the most appropriate care is through primary care at that point in time, there can be a recommendation and a referral back to primary care, but the first point of contact is hospital staff at this point in time.
Makes sense. Wonderful. So thank you for helping me stall as we get the poll answers in here. So I'm going to end the poll now. We got a lot of responses, and I'm going to share that with the group. So what we're seeing is pretty well distributed, actually. So we have 60% who are doing RPM for chronic care, 25% doing it in surgery and some other things. And I would say probably lower, maybe 50%, if I can do math quickly, who are kind of in the researching and evaluation stage. So I think what's going to be great is for those of you who are not quite, we haven't done something like this just yet, you'll get a lot of good feedback on how do you actually think about this, pick something, deploy it. And for those of you who are already doing this, hopefully you get some insight from the group today on how can you maybe take this to the next level. Wonderful. So maybe segueing here, Caroline and Andrea, you've both been leaders deploying digital care journeys. Sorry, 1 second. This poll kind of keeps popping up on me. You've been leaders in digital care journeys and remote monitoring. And folks who are just starting this journey are often thinking about solving a variety of different scenarios. So I know some folks we talk to are bringing something like this in to increase same-day, discharge. Others are trying to cut the backlog. Some are more focused on the, post-acute. We want to reduce ED visits and readmissions. Maybe Andrea, I'll start with you. Like when you first started down this journey, what were the main challenges you were hoping this would help with?
Thanks, Josh. So I think we're really focused on seeing how we could decrease length of stay and really therefore increase our throughput through our surgical program. And so our program really focused on shoulder surgeries, total hip and knee replacements, thyroid, mastectomies, prostatectomies, gynecology, surgic, and bariatric surgery, and then gen surge as well. So we had to cast a big net, and we're hopeful that we would see that we would actually be able to impact our throughput, which we were able to do. We really wanted to focus ourselves on providing patients as well with the autonomy to feel ready to be discharged and feel like they were actively participating in their care at home. And that was important to us as we developed what our clinical care pathway would look like for remote patient monitoring. So those are really our first sort of priority areas. And we set out that as our vision to make sure that we could do what was right for the patients that we were serving today and making them feel empowered to be part of their journey, but also increasing the number of patients we were able to care for so that we were being equitable with the resources within our hospital.
And Caroline, was that similar to your why for starting this, or do you have a different initiation?
I actually started exploring Seamless MD in 2017. And of course, funding was a rate limiting factor. And fortunately in Ontario, our provincial government through Ontario Health created the opportunity for us to pursue remote patient monitoring. So we were very quick adopters in November of 2020. What we had been working on was obviously reducing length of stay, but also we wanted to make sure throughout the pandemic that we could continue to offer patients surgery, but minimize the amount of face time, the amount of time that they had to present in person for any type of appointment that could actually be offered virtually. We launched our hip and knee pathways first because they're high volume, but we have very similar pathways to Andriana across surgery, but we also have oncology for systemic therapy, radiation therapy, as well as palliative. And we also have some women's health programs. We were able, through the support of Seamless MD, to reduce our length of stay from 2.2 days to below 1 day. So in the region, 95% of our patients go home same day. At Thunder Bay Regional, that's more in the 60 to 80% range, just because we do treat the patients with higher comorbidities. Simultaneously, while decreasing our length of stay, we reduced our ED visits specific to the hip and knee pathways by 50%. So extremely dramatic results and significant cost avoidance for our patients. This also enabled us to actually meet our funded targets for during the pandemic and beyond. When we were in recovery, we were actually able to provide care when many hospital sites were not able to do so.
Wow.
Josh, maybe we just, oh, sorry.
Oh, no, go ahead.
Quickly build on Carolyn's comments. I see there's a question in Carolyn's that spoke to the experience at her organization, but we also did see, I just took a look at our latest quarter of data that's available. And in the last quarter, we saw that about 35% of our patients avoided a visit to the ED. So we are able to, with the pathways, actually avoid having patients come back to the ED where not appropriate. That's not to say that some patients don't need to go back. There are those patients who will need to go back. And the way that the app is configured and the pathways flow, we're making sure that if patients do need to come back, they're actually told to do so. And so really walking that line and building the pathways to meet the needs of our patients is integral to making sure that they do receive care at the right point in time.
Well, first of all, congratulations to both of you all and your organizations. That's just phenomenal impact on not just the patient care, but on optimizing the health system resources. Of course, the devil's in the details for how to make this work. And I think one of the things I'm a big believer in is that technology is kind of the relatively easy part, to be honest. It's the people, the process, it's the thought you put into the implementation to make it successful. And so one of the questions that came in through the chat is actually for you, Andriana. So in terms of how you set up the monitoring for your care team, someone was asking, is this care team like on call 24/7 to monitor all of this and respond right away, or how do you think about that workflow?
I saw that question from Bren, so I'm happy to answer that. So the patients do complete daily checks. Most often they will do those checks during daytime hours when we do have our nursing staff working, and our nurses are the first point of contact that do monitor the information that does flow through and would be notified on the dashboard if there was a patient that was effectively out of compliance for acceptable thresholds to continue to self-monitor at home and require follow-up. So if that does happen during the day, again, the patient, if they're in the red zone, I'm going to call it, they will be told to automatically go and seek help and go to an ED. But most often our nurses, when patients do require follow-up, will do that during the day. If they do complete this after hours, we do have language that says if you need imminent support, please do go to the ED and seek that. So we don't have, the short answer is 24/7 monitoring, but I would say that the data that we've seen most recently would suggest that we probably don't actually need it anyways.
Great point. And I think one of the things that we've learned is setting the right expectations with patients is so critical. So I think for a lot of y'all and our partners, part of the patient feedback they get in the application would be what to expect. So for some people, that's, hey, we're checking this between 9 to 5, Monday to Friday. If something happens after hours, this is what you should do. But that communication, I think, we found to be really important. One thing I did want to dig into is how and where you start. So for example, I know, Carolyn, you mentioned earlier that you started off with hip and knee replacement. Any suggestions for the group who haven't started yet? How should you decide like which programs to start with, and why is picking the right group to start so critical?
Well, for us, we really needed data to present success. This was a pilot project, and we needed to demonstrate, quickly that we were getting return on investment and meeting the needs of all the stakeholders. Obviously, the patients but also providers, the organizations, and the health system as a whole. So we picked high volume, high acuity surgical case types, and we really built from there, built based on volumes and our most at-risk patients. One of the questions in the Q&A I see is around our demography. We have rural, remote, and urban patients that we serve, a lot of remote patients. And we do have an older, sicker population here in Ontario Health Northwest. Another one of the questions that ties into this is, how do we generate our ED avoidance data? And what I did is I ran the data prior to implementation for those cohorts, obviously made sure that the number of patients that we're measuring are equitable in both groups. And so I did 2018 to 2019, how many hips and knees did we do? How many patients went back to the ED? What was their length of stay? And then I've continued to measure that every fiscal year after, since we've implemented the remote patient monitoring app with Seamless.
It sounds like actually both of you have some pretty engaged data teams at the organization. I know that in some places, some folks have struggled to get kind of engagement with access to internal data to demonstrate what's working, what's not working. Any advice to some folks out there on how to get the data folks on board with working with you on these analyses?
Maybe I'll start with this one. And it's a great question. And I'll start by saying I am the data person. So Carolyn today here provides the clinical perspective and voice. And it's been great to hear about another organization's experience. And I think one of the key success factors for both of our organizations has been the fact that I'm willing to bet Carolyn will say that at the very beginning of conceptualization of what this would look like at Thunder Bay Regional Health Center, the data team was at the table. And so when we talk about how you're going to construct the workflows, the care pathways, understand where you can pull from data, it all needs to sort of start from that beginning and mapping your current state, understanding what that future state will look like, and defining any potential gaps or risk points with how you'll actually be able to collect that data is really important to do from the get-go. And so we were very, very fortunate at St. Joe's to have very close partnerships with our surgical services team. And the director of surgical services at St. Joe's and I worked hand in hand as this program was struck to understand what the needs would be, both clinically, but on the back end as well as data, because we needed to measure success. And like Carolyn said, we had to start in pilot form. Funding is always a challenge. And so we had to prove that this program actually worked and delivered an ROI, if you will. And so that was integral to making sure we built that into the program from the get-go, because we were accountable to showing what we hoped would be and what ultimately was the success of the program.
I think, Andrea, I think you shared a really powerful point. It sounds like when you involve, folks like the data team early on in the implementation, they are part of it. They have a sense of ownership over the initiative as well. And so they actually probably care about the data. They want to know, is this working or not? Is it making an impact? But if you bring them in 3 years after you start this, they don't have that same emotional investment in the success of the initiative. So that early engagement seems like a really, really great strategy. I did want to shift gears a little bit, because I know there's a bunch of topics we want to cover. The patient experience really matters here. I'm curious, what's been the most surprising thing about what you're hearing from patients about the initiative? Carolyn, we can start with you.
Sure. We definitely use a nurse practitioner model. Recruitment and retention in the North is very challenging, and many of our patients are often orphan patients. And we really needed a team where when the patient reaches out and has a wound issue or a pain issue, we don't have to put them on hold and escalate to someone else, be it the surgeon that we are therefore trying to track down. We really needed to be able to have a team that can serve the patient right away. And I think in our instance, that has been critical to our reduction in ED visits. I can't emphasize enough the patient feedback on the support they get from both our clerical team, They have direct line. When patients call, someone answers and connects them as soon as possible to our nurse practitioners. So the nurse practitioners are not immediately screening calls. We do have a front line that's doing that. That front line is also critical to our data. Believe it or not, myself and my front line are the data team. I'll share a story. One of our surgeons was having pancakes, fin pancakes, which are very popular up here, in one of our local restaurants, and overheard patients talking about this new program that Thunder Bay Regional has on remote patient monitoring for their surgical patients, and how incredible it was, and was really giving a thumbs up endorsement while eating pancakes. We've had nurses that have gone to the fracture clinic for their follow-up care for their second joint, their other knee, their other hip. And they've said to our team, this was a game changer. I'm a nurse. I had my first knee done without this support. And I can't tell you enough how much better my experience was the second time around because of this program. And then the last story I'm going to share, we're saving lives. We've encouraged patients to go to the ED that ended up with bilateral blood clots in their lungs. We had a 46-year-old woman who was 3 weeks post-op and reported on her health check at 8 p.m. at night that she was having chest pain. She was post-op shoulder surgery with chest pain, and the app told her to go to the Emerge. She did. She was having a heart attack, and she had a good outcome. And our team followed up with her and said, without the app, would you have gone to the Emerge? And she said no. So I'll pause. I don't want to take too much airtime, and I'm sure Andriana has her own stories to share.
Carolyn, those are great stories. I'll echo much of what you said, and I'll keep it short and sweet because I know Josh has more questions for us. But I think what's really been interesting for me is hearing the feedback from patients around their comfort and confidence in their ability to recover successfully at home. And so we have a patient who saw us over the summer, and I'll just sort of read a quick snippet of what they said. They said that I liked that I could fill out all of the questionnaires, and that it would let me know if it was normal or if a nurse was going to contact me. It made me feel secure and less anxious knowing that I was being checked on every day. Thank you. The gratitude that we've heard from patients for just providing them with these extra contact points has been immense. And I think it just shows that they want to be part of the team. They want to know if they're doing the right things, and that patients are willing to take those few extra steps, like those daily checks at home, so that they can get that real-time feedback on, are these things normal? Am I doing the right things? And if something doesn't look normal, or perhaps needs a little extra follow-up, not to worry, you're going to be hearing from someone. I think providing that level of comfort to patients above and beyond changing the outcomes is incredibly important.
Here, Carolyn, passing the mic back to you.
Yeah, the last comment I'll make is that instead of us chasing down the surgeons saying, do you want to participate? It's actually the surgeons chasing us down saying, how do we get in on this? We want to be a part of it. That's how good it is.
That's amazing. And I just want to commend you both. I mean, I love how you focused on the patient stories just now, because we can talk all day long about the impact on KPIs, on metrics, which are important from a system point of view. But I think we all will remember the patient experience and the stories more than we'll remember kind of the metrics. So I love that. So thank you for sharing that. We did get a question in the chat about integrations with EHR. So like perfect segue to deeper dive with Andriana, because I want to give kudos to you and the St. Joe's Healthcare Hamilton team. You are our first partner in Canada to integrate Seamless with Epic and MyChart, as known as Dovetail at St. Joe's Hamilton. So I'd love to dig in deeper to those, that great work that you've done with us together. Maybe to start, let's talk about the patient side. So you actually integrated Seamless with your Epic MyChart / MyDovetail. Why was that so important? What's been the benefit of that for patients?
Yeah, absolutely, Josh. So patients today have 3 ways, and I want to reiterate that they can choose to engage with their Seamless MD platform. So they can go through and just do it through the web browser. They can use the Seamless MD smartphone app, or they can go through an integrated experience through their MyChart app. And so what's been important for us as we've looked at our telemedicine office and the key tenets that we have in terms of enabling patients to be active contributors to their care team is giving them that choice. And so we have close to 200,000 patients in the Hamilton region that are on our version of Epic MyChart, which we've branded as MyDovetail. And a subset of those patients are Seamless MD enrolled remote patient monitoring patients as well. Patients are familiar with accessing their health record through our MyDovetail application. And so you can see there's a screenshot there on the right-hand side that shows the type of information they can regularly engage with. Things like their visit information, their labs, their medications, their plan of care, any questionnaires they may have for ambulatory clinics, etc. They want to be able to access Seamless MD in that sort of one-stop shop location. And so for us, we knew it was really important that there would be a launch point within our Epic MyChart platform to allow them to do just that. Often as well, patients are looking at their most recent lab results or medications, and they want to be able to use that as one of the inputs to the work that they're doing when they're answering their daily questionnaires. And again, so from a convenience point and perspective for our patients, we wanted to give them the ability to do so, and that was very important for us. So yes, we were very excited to be the first organization to be able to do this in Ontario, and do see that the majority of our patients actually do access this through our MyChart application today.
It's amazing. And so, Andrea, you actually took it one step further. So St. Joe's Hamilton has been one of the leaders in leveraging the Ontario trusted account approach and framework. You mind sharing a bit more about what that is and what we did together on that?
Yeah, happy to. So the Ontario Trusted Account really allows patients to access all of their mobile health applications through one, what I call a digital front door. So the idea is once they go through that one digital front door, things like could be their MyChart account, could be Seamless MD, could be other scheduling registration applications, could be community resources, are all available for them where they can easily interchangeably sort of navigate between those applications without having to most often log into multiple different screens, etc. And so as again, we looked at sort of the ecosystem of tools available to our patients, it was really important to us that we had an Ontario Trusted Account service included with Seamless MD, and that patients were able to go through that one digital front door to access this information. And so I think Carolyn said earlier today, many of the patients that leveraged Seamless MD are complex patients. And so we understand that they're likely accessing more than one health service at a time. And so it's been important for us to make sure that we're thinking about the patient journey and how they're engaging with all of the different digital tools and doing what we can to streamline that experience for them. So we have branded our Ontario Trusted Account as our St. Joe's Navigator. But when a patient goes through a St. Joe's Navigator, they are able to access Seamless MD.
Awesome. So, I think one of the things that we always hear from clinicians is that as much as possible, we want the clinician experience also more deeply integrated with less clicks. And so one of the nice things that your team also did as well was actually embed Seamless into Epic to streamline parts of the clinician experience. Do you mind sharing a little bit about what that is and why that's so important from a clinician point of view?
Absolutely. So just like it's important for our patients to have a good experience with the digital tools they're using, we want to make sure that our clinicians feel ready, able, and willing to work through their busy schedules and have the access and information that they need at their fingertips and not have 10,000 windows open at once. And so you can see there's a little red box around a Seamless MD little sort of embedded workflow. And so right within the home screen in a patient's chart, if that is a Seamless MD enrolled patient, they will be able to actually see information related to Seamless MD directly in our legal medical record and our integrated health information system. And so it's important for our nurses who work every day within the system to be able to track those patients and receive the dashboards and alerts in real time within the system they're working in. So that's what you actually see on the right-hand side of the screen. On a previous slide, Josh, you showed that that's really a seamless sort of MD dashboard. And so we've been able to effectively embed that right within our Epic system. And it's actionable. So if nurses need to take action, they're able to do that from within the workflows that they're in. And the integration and interoperability means that the information is flowing to the right places and can be used for things like following up with patients. And then when it comes time to report on whether or not things worked, being able to pull the data on the back as well in terms of actions taken and impact to care provided.
Amazing. And obviously the workflow, this could streamline part of it. But let's be honest, bringing in a new solution and technology like this does impact the clinical workflows in other ways. There's a question in the chat about how much training is required of patients, or how long does it take for staff to get patients kind of bought into this? Maybe Carolyn, I'll go back to you. What's been your experience with the impact on staff time to actually enroll and educate patients on this?
Yeah, it's quite brief. It's probably about 5 minutes per patient. We do really focus on consent and privacy. And then really all they need to do is give us their email and they send a link. Our first line is to have the patient directly involved with the program themselves. If they feel that they're not tech savvy, we offer that their caregiver can do that, be it their son or their daughter, their partner, a friend, a neighbor. And then last case scenario is if neither of those options are available, we still give them the direct line to our NP team. So that, and we make it very clear to all of these surgical patients, this is your first line of action. If you run into trouble, we're here to help you.
Amazing. I know there's a lot of comments in the chat. There's a couple more things I want to make sure I give a chance for Caroline and Andrea to dig into. So I'm gonna switch gears again. You all touched a little bit on this earlier. It's kind of a teaser, I think, on outcomes, but I did want to give you a chance to really showcase the great work you've done. So Caroline, we'll start with you in Thunder Bay. Tell us a bit more about the data you've been able to produce.
Yeah, I mean, I've shared it earlier in the presentation. This is just the hard data that we were able to demonstrate after year one again, we compare our control size to the post-implementation sample size, and they're quite comparable. We demonstrate that we are able to drop length of stay by 1.19 days or 48%, and simultaneously reduce ED visits by 31.7%. It ranged from 20 to 40%, depending on the hospital site, because this data incorporates four surgical sites.
And I think recently you dug in a bit more on the total joint data and even across multiple sites. I'm going to bring that up here if you want to highlight anything specifically about that.
Sure. It's showing scrambled on my view though.
No, it's not just you. It's my slow computer. It's going to get there.
Yeah, there we go. So really total all four sites data, our sample size went up by 12%. Across the four hospitals. Again, this is specific to hip and knee. It's the easiest to study. It's the most impactful in terms of volume. And we're doing probably 1,200 surgeries per year, and we were able to demonstrate a 67% drop in return visits to the ED with the support of our NP-led remote patient monitoring team. So
I think it's just amazing that your volumes went up, your length of stay went down, and you kept patients at home healthy out of the ED. That's a remarkable piece of work by your team. Congratulations.
Thank you.
One last one that you also had here was, I think your team also did a more rigorous kind of matched control, more matched cohort analysis on hip and knee patients where you controlled for like age and BMI and so forth. Anything you want to share about this one?
I mean, really, it's just once we studied, it was obviously a smaller sample size, around 100 people. But once we controlled for all of those variables, we were still able to consistently demonstrate that there was in this one, a 50% reduction in return visits to the ED and 58% reduction in readmissions.
Pretty remarkable. Andrea, I want to give you a chance as well. I know your team recently did an analysis on some of your patients.
Yeah, happy to sort of speak to what we saw at St. Joe's. And so you can see here, we were able to decrease our average length of stay by about 68% or 2.4 days, decrease our 30-day readmission rate by 2%, And the latest and greatest data for ED visits within 30 days has also decreased nearly 20% at 17%. So really good data, exciting to see that we're actually moving the needle and that the outcomes that we can achieve are tangible and real.
Amazing. Well, congrats to both of you. And I know it's just the two of you on the line today, but I know there's a ton of great people behind these amazing results. So congratulations again. Lots to be proud of. Getting these sorts of outcomes is not easy. And I'm sure you've both learned a lot, things that went well, things that didn't go well, that we all learned from. And so I did want to segue a little bit to kind of some learnings and best practices. So I know there's a couple of examples on here, but maybe Caroline, we can start with you. What's the biggest lesson you take away from this, or the biggest best practice you would advise others who are trying to embark on this journey?
Oh, that's a good one. I'm not really sure where to start. I think you need to know what your team looks like, and because there's different clinical models that can work. And Andriana and I have a very different model. So I've mentioned that I have an NP-led team. We have a 2.0 FTE that supports really thousands of patients across 4 hospital sites. We are supported by our executive steering committee, which is the CEOs and the leadership teams of all of those 4 hospital sites. And we are constantly showing them our success data. And we're sharing that success data with our funding partners, Ontario Health, as well. Again, we do a lot of shout outs to our supporting partners, our surgeons, and the clinical care teams, because there are so many positive comments coming across the app. People don't receive good news on a regular basis, so it's really nice on a quarterly basis. Seamless pulls some extracts of comments, and we're able to share these really great shout outs to our clinical, clerical, and surgeon team members, and really keeps the enthusiasm going. And then obviously our senior leadership team, our board of directors, we're updating them on a fairly regular basis as to how it wasn't just a wow first year, that the success metrics that we were able to demonstrate early on in the pilot are sustainable. Andrea?
Everything that Carolyn said is accurate and required in order really to build and scale and have longevity of the program. The one other thing I will mention is we have a manager that is so incredibly dedicated to this program and does the coordination efforts both with our accommodation nurses that support the program, but also ensures that all of the good things that Carolyn was referencing in terms of communication upwards and celebrations is completed. You do need someone who's going to be dedicated to this work. It could be anybody within your organization, and Caroline and I do have very different ways that our programs are operated within our organizations, but you do need to identify those key change leaders and make sure that they feel prepared to actually champion the change, find that coalition of the willing, and then continue to mature and evolve the program.
Amazing. I want to underscore some of the feedback I just heard. So I think, Carolyn, you mentioned how it's so important to celebrate those wins and feedback that data back to the care team. And I think one of the things that I've learned is that oftentimes when your organization is so big, that success doesn't always get communicated regularly to the team. So often people keep working on these innovative initiatives, but don't even realize that you're actually making a difference. And so I love how you're investing the time to actually share the information, share the data, remind people this is why we're doing it. That's so awesome. And I think Andrew made a great point about engaging the coalition of the willing. I'm kind of curious, maybe I'm sure you've both come across folks who are very skeptical. Maybe they don't want to change how they do things, because let's be honest, 5 years ago, you weren't doing any remote monitoring of any kind. And so it's not like you're just asking them to do a slightly different thing. You're saying, hey, we're re-engineering how we do care. So what do you do when you come across folks who just aren't bought in conceptually to start?
I'll start. I actually haven't run into it.
So I think, you know what, it's interesting. We're at a point that COVID, we don't talk about it as much anymore, and I'm grateful. But COVID really changed how people look at technology. And I think the barriers that we had prior to 2020 in terms of comfort with technology, acceptance that virtual care is care and maybe actually more appropriate care sometimes, I think people have started to embrace and understand that. And sometimes it is about education and bringing people around and helping them understand that a little bit better. So there is some really interesting work that came out of the Center for Integrated Care at St. Joe's Health System last year, looking at what a remote patient monitoring maturity model looks like. And it looks at sort of 5 different facets and where you can be on that journey. And I think understanding where your organization is on that journey is important, because then you pivot your change management strategy and you understand how to actually onboard perhaps some people who are a little bit more apprehensive about this change by giving them the right tools and supports. If people are uncomfortable, you need to acknowledge that and determine how you get them to a state of comfort. You can't just say, here's a technology, it's great, use it. You've got to really make them understand the why and make them feel confident in their ability to do so.
Totally. It can't be a forced initiative that you have to really work with them to help them understand the value and get bought in. Makes total sense. We got a couple of minutes left, so I'm gonna switch to kind of the Q&A piece here. More so, there was a question that came up about devices. So someone was asking, or have you started providing devices to patients who just may not have them right now?
No, that's a really expensive model. So no, we have patients that can use their computer, they can use a tablet, they could use a smartphone.
We are also a no. I will say there's some really interesting health equity work going on across the province looking at this. And I wish that we were a little further along that journey, but at this point in time, we are not.
I will say, if you look at the data, I think about 90% of folks have access to a smartphone or a tablet at this point. That doesn't even include the desktops. And I think the prediction is that the next 5 years, it's going to reach near 100%. So it's not 100% yet, but definitely we're seeing the trend getting there. There was a question about how long integration takes. So, Adriana, do you recall like how long did that process take, and any other advice about navigating that process?
Oh, Josh, I saw that question. I'm trying to remember, and I actually went back through email on this webinar to see if I could find the timelines. I think about 4 months. Does that sound about right to you as well? And it was 4 months of planning. It's very quick. I will say Seamless MD is available through sort of an Epic application orchard. So they make it really simple. It's not difficult. What's a little bit more difficult is coordinating all your resources, carving out dedicated time for them to do that, and having some internal sort of change process pieces. So the build itself probably was less than a week to complete. But we were doing this at the very beginning of our program. It was important that we had this from the get-go. And so it just took a little bit longer for us at St. Joe's.
Yeah, I think, Angela, to your point, I think that the big feedback we hear from the digital and IT teams is that the actual integration part is easy, but the thought that you put into how do we want to set the integration, what's the right user workflow, the right user permissions, that's the stuff that you want to make sure you do intelligently, and that does take some time to plan out correctly. So that makes a ton of sense. Wonderful. So I know we're at the hour, so I think we'll stop there. I want to say thank you, Carolyn and Adriana, for being amazing stars today and sharing your wisdom with the community. Thank you, Digital Health Canada and Shannon, for organizing all of this, and thank you all for coming today. It's been awesome to have you. You will get a copy of the recording. People are asking us about this, so don't worry. You can rewatch this 100 times and learn a bunch more. Thank you, everyone. Really appreciate your time today.
Can I share my screen just quickly?
Go for it.
Thank you. Perfect. So again, I hope you enjoyed the session. Thank you again to Seamless MD. What a great presentation. I think we could have been here for another hour having a really great conversation. One of the things I wanted to mention is we are going to send a quick survey out to all of the participants. So hope you'll take the 2 minutes to fill this out. There is a QR code on the screen if you want to just take a second to capture it. Our Digital Health Canada community platform is live. We will be posting all of the recordings in that platform. And I'll just make one more mention, a regularly scheduled webinar Wednesday, another webinar tomorrow. We do have another virtual conference coming up November 7th. It's the Driving the Future of Digital Health Conference. Its focus is on trust in healthcare. So I encourage everybody to go to the website and take a look. And if you happen to be in Regina on November 14th, we will be having a breakfast there. And that session is selling out pretty quickly. So register if you are going to be in town. Thank you all. What a fabulous session. Really appreciate it. And hope you all have a great day. Thank you.
Thanks, everyone. Bye-bye.